Most people believe that if they choose a good surgeon, everything else will take care of itself. The operation will go well, the blockage will be fixed, and life will return to normal. But what nobody tells many patients is this: some of the most dangerous bypass surgery mistakes happen long before the operation ever begins. I've seen patients sign consent forms without fully understanding their options. I've seen families focus on whether their loved one would survive without asking what recovery might actually look like. I've seen people assume bypass surgery would solve everything, only to discover later that it didn't. The surgery was successful. The heart was repaired. The doctors were pleased. The family felt relieved. And then the recovery became much harder than anyone expected. Weeks passed. Then months. They survived the surgery, but never fully returned to the life they thought they were protecting. The truth is, some of the biggest dangers surrounding bypass surgery are not surgical mistakes. They're patient mistakes, decision mistakes, mistakes that often happen before anyone enters the operating room. And before you or someone you love agrees to bypass surgery, there are 5 dangerous mistakes you need to understand, because the last one may be the mistake people regret the most. My name is Dr. Q Tran. For the past 23 years, I've helped people across the United States deal with heart disease, poor circulation, stroke risk, and many of the hidden challenges that come with aging. And one thing I've learned is this: the operation is only part of the story. What happens afterward matters just as much, sometimes more. Because after the age of 70, the body changes. The heart works harder. The blood vessels become less flexible. Inflammation lasts longer. The kidneys process medications differently. Recovery takes more time. And the brain, this is often the part families least expect. I've seen families prepare for surgery. I've seen them prepare for the hospital stay. But I've also seen them completely unprepared for the recovery that followed, the confusion, the weakness, the setbacks, the frustration, not because the surgery failed, not because the surgeon made a mistake, but because an aging body responds to stress differently. I often tell my patients something very simple. An 80-year-old body does not recover like a 40-year-old body. The surgery may be the same. The recovery rarely is. And that is where many dangerous mistakes begin. People prepare for the operation, but underestimate everything that comes after it. And before you or someone you love agrees to bypass surgery, there are 5 mistakes you need to understand, because most people don't realize they're making them until it's too late. Mistake number 5. Never asking about other oppositions. For many people, this seems harmless. The doctor recommends bypass surgery, so they assume the decision has already been made. The problem is, that assumption can be dangerous. Because not every patient is the same. Not every heart is the same. And not every recovery looks the same. Age matters. Frailty matters. Overall health matters. And sometimes, those things matter more than people realize. Studies show that treatment decisions often depend on far more than the blockage itself. Recovery risk matters too. Future quality of life matters too. I've seen patients feel relieved when a surgery date was finally scheduled. They thought the hard part was over. It wasn't. Months later, they were still struggling, still recovering, still wondering whether they had fully understood all of their options. The surgery was successful, but the road afterward was much harder than they expected. A safer approach is simple. Slow down. Ask questions. Make sure you understand every reasonable option before making a decision. Ask your doctor this: if I were your parent, would bypass surgery still be your first recommendation? Because sometimes, the most dangerous mistake is not choosing the wrong treatment. It's agreeing to a treatment before fully understanding your choices. Now, I don't want this video to scare you. Really, that's not the point. Because many people have bypass surgery and recover well. Many go home. Many get stronger. Many get back to the people they love. So if you're feeling a little uneasy right now, I understand. These aren't easy decisions. They shouldn't be. We're talking about your heart, your future, maybe even someone you love. But information without action is just fear, and fear is not the goal. Understanding is, preparation is. You don't need to know everything today. You just need to ask better questions. One step at a time, one decision at a time. Because the more you understand now, the less likely you are to be surprised later. The good news is, this is not the whole story. Because I've also seen something else. I've seen people in their 70s, their 80s, and even beyond.
Recover better than they expected. Not perfectly.
But well, I've seen people go home,
Sleep in their own bed again.
walk through their front door again, sit at the dinner table with the people they love. And sometimes, those moments mean everything. Recovery doesn't always happen quickly. It doesn't always happen all at once.
But it happens.
One good day, then another, one small step at a time. So if you're feeling worried right now, I understand these are big decisions. But don't forget this. Risk is part of the story. Recovery is part of the story too.
Hope is part of the story too.
I've seen families prepare for the worst and later celebrate milestones they weren't sure would ever come. The first walk, the first trip home, the first family meal. Those moments matter, and they happen more often than people realize. So don't leave this video feeling powerless, because you're not. There is still reason for hope, and there is still reason to believe that good outcomes are possible. I still remember a patient named Michael. He was 76, and he was afraid.
Not of the surgery. Of what might happen afterward. His biggest fear wasn't dying.
It was waking up and no longer being himself. So he slowed down. He asked more questions. He made sure he understood his options. The surgery went well. The recovery wasn't easy. There were difficult days. There were setbacks. But months later, he was back home, back with his family, back living his life. And that's why I still remember him.
Not because of the surgery, but because he got back.
To the people waiting for him.
Before we finish,
remember this. A diagnosis is not a verdict, and a recommendation is not a command. Fear is not a plan. Understanding is. Questions matter. Preparation matters. Not every surgery should be avoided.
Not every surgery should be accepted.
What matters is understanding why. Because this isn't just about a procedure. It's about the life that comes after it. The goal is not simply more years. The goal is better years. Before we finish, remember this. Recovery matters. Independence matters. Quality of life matters. Questions matter. Preparation matters.
And sometimes,
the smallest decisions made before surgery become the biggest decisions afterward.
This isn't just about a bypass procedure.
It's about coming home. It's about getting back to your routine. It's about getting back to the people you love. And those things are always worth protecting.
I'd love to hear from you. If you were facing bypass surgery tomorrow,
what would be your biggest concern? The surgery itself or the recovery afterward? And one final thought. This video is for education and awareness, not personal medical advice. Every person is different. Every heart is different. So please talk with your own doctor before making any medical decisions. They can help you understand what's right for you. Take care of yourself and take care of the people you love.